Good afternoon, everyone. So people are joining. My name is Samir. I am the CME organizer at Zahra Hospital Dubai. Uh, and I would like to welcome you all to this scientific session to be presented by Dr. Ahmed Labib. Dr. Ahmed, are you in?
Hello,
Dr.
Mr.
Ahmed. Yeah,
Yeah,
hi,
good.
Dr. Ahmed. Okay, all right, you're in. So
Yeah,
let's wait for 5 minutes so that more
yeah,
people will join. So far, around 10 people are with us. So we'll be starting exactly in 2 minutes time.
yeah.
All right, so we have Jeffrey with us, we have Mark Field, we have Catherine.
Ask them if they can see the screen.
Yeah,
Screen is showing,
yeah, screen is showing.
rotating.
That's perfect. Yeah, that's perfect.
Okay.
So let me let in the participants. Participants are joining. We have Mr. Daljit Singh with us. Welcome. We have Santijia. More people are joining. All right. So it's exactly 1 p.m. So I think we should start the program. Now before we start the program, I would request all the attendees to mute their audios so that there is no disturbance during the presentation. Uh, I would like to formally welcome you all to this meeting, to this scientific session, which is to be presented by our expert orthopedic surgeon, Dr. Ahmed Labib. Dr. Ahmed Labib is the consultant and head of the orthopedics department at Al Zahra Hospital Dubai. Regarding his experience, he has got a rich experience of more than 25 years in the field of orthopedic surgery. He is an expert in managing all trauma cases as well as joint replacement cases for the knee and the hip. Dr. Labib participated in the teaching medical students at Cairo College of Medicine in Egypt and has published many scientific papers in different national and international journals. Moreover, he has presented articles and lectures in both national and international courses and conferences. He's an expert in the all orthopedic cases and orthopedic field. I welcome Dr. Ahmed Labib, and the floor is yours.
Thank you, Mr. Samir.
Yeah.
Really appreciate it. And it's my pleasure and honor to be here today to talk about an on the rise problem of back pain. Back pain have always been a worldwide global problem because of its impact on the health of people and on the economy. So as we have seen in the last 1.5 years that they are closely related. And with the COVID and the online working, online platforms for students, universities, it have been more and more on the rise, not only as regards the incidence, but also as regards the severity and the presentation age. So worldwide, 85% of the population experience back problems by the age of 50. But recently, I am seeing 16 and 17 years old adolescents with serious back problems. Few weeks back, a 15 years old, we can say a kid, with a lumbar disc prolapse. And all of this have been just because of bad posture, lack of exercises, bad daily habits, and work-related problems. On the long term, these people, if they do not really take care of their back, the problem keeps on deteriorating. And this is the difference between the spine and back problems and joint problems. Joint problems can get cured with medicine, with physiotherapy, with rehabilitation, with minimally invasive techniques, with injections. But the back problem there are two factors for controlling the progression of the problem: the age of the patient, what he will do about it. It's a mutual relation between the physician and the person, how to take care of his back so that his minor problem does not complicate down the line. Factors that contribute to increasing of the magnitude and the severity of the back pain is the age, the previous level of physical fitness and conditioning, flexibility, strength, genetic history and family history of back problems, and any bone or developed structural abnormality during the growth phase. There is a lot of back problems, and once you start having back pain, if it persists or recurs or becomes severe, you have to check with the physician what is the cause of the pain. For most of the people, I don't have a disc problem. Okay, that's good. Oh, I have a disc problem. That's serious. No, it's not about this. There is a lot of structures that can be involved in initiating the back pain. Joint stiffness, because in the back of the spine there is a small joints called the facet joints, and these ones, they get damaged by cracking the back, which is a habit that have to be stopped by people who are involved into doing this as a habit. Acute strains and sprains, like any other joint in the body, there are ligaments connecting the back of the bones together, and muscle spasms or disc bulge or herniation, and we're going to get into detail about this soon. Degenerative disc disease, and yes, the spine gets arthritis when multiple levels gets involved in the problem. So to understand why the back pain happens, we should know that, like any other structure, the back is formed of bones, joints, discs, muscles, and ligaments and nerves, and a problem in any of these can be the initiator of your back problem. The spine is made in a unique way to be very strong. It's holding your whole upper part upright and still to allow movements and flexibility in all directions. And to do this, it's formed of the bones, the vertebrae, and in between them lies the disc. And the disc is unique in its structure. It's literally like a balloon filled with water. 80% of the middle of its part, the nucleus, is water. It's like a water cushion to allow rotations and to allow bending and lifting. And when we overload this water cushion, it starts getting compressed. And the more you apply compression in it, the more it bulges to the back, and from here starts a problem. So problems of the spine can be either these small joints at the back here that move the body forward and backward, or the ligaments connecting these bones together, the muscles at the back, or the most common problem, which is the disc in between the bones to allow the movement. When we overdo the movement on that by wrong lifting, by bad posture, by lack of strength of muscles, by an accident, it gets compressed. And once it gets compressed, there is no place for this water cushion to go except to the back, to the foramen from where the nerve goes out, and here starts the problem. So the spine is holding the spinal cord, which is a group of the nerves, and after each bone, the nerve comes out going to a particular direction to perform a certain function, feeding a muscle or a part for a sensation. And if we go to the previous one, the nerves are collecting here to go into the leg, and in the neck, they collect the same to go into the arm. So if this one shares the narrow canal with the nerve, then we start having not a back pain only, but also what we call a sciatica, which is the referred pain to the leg. And this is a sign that the problem have been there for a long, or really it is getting more and more. And the back injury cycle, as we were mentioning in the beginning, this is the problem. It's not like a joint that can be cured with physiotherapy. It's a back problem, cannot move, you stop moving, you get stiffness, weakness, you stay in your comfortable posture, you cannot help it, and the problem escalates. Leading causes of back problems include, from the beginning, poor body mechanics. They will not raised by the family to keep a good posture. You have to keep telling your kids, please Stay upright, especially in the digital era we are all trapped in. Stay upright, do simple exercise, stressful living, work habits, prolonged hours of working, 14 and 15 hours behind a desktop or a laptop, and in the middle of that holding your mobile. So this creates abnormal pressure on the discs and the nerves and the muscles. And as any structure on the planet, your body, if it is subjected to excessive load, it wears out. So the general physical fitness with age declines, or if you are not prepared by doing any sports since you were young, definitely in the middle age, you will have a loss of flexibility, loss of strength, and you'll be more liable to back problems. Or an accident happens, a slip, a fall, a bump at a high speed, osteoporosis or bone weakness, and then you are doing activity you are not entitled to. Like you decide, okay, I'm gonna reverse this, and then you do the opposite. You all of a sudden go to the gym and start heavy weight lifting. So back safety is not just a work thing, it is a lifestyle. It's a habit, it's an attitude of how you are taking care of your body and your health. You have to have all day, every day, good body mechanics, proper lifting techniques, safe postures, stay physically fit, stretch and exercise, and to stay healthy. Some people still think, okay, I'll go to the doctor, he will give me medicine, I'll be fine. This will not work in a back problem. Most of the bones and joint problems are mechanical problems that demand a mechanical solution. So if we are having the old school of, okay, let's give medicine, a lot of painkillers, as we have seen our old uncles and parents, the bag of medicine keeps increasing and the problem increasing with it. So number one, the protection and the prophylaxis is better than the treatment. General rules: if you're gonna lift something heavy, you have to have help. You have to have your back straight. Keep the load close to the body. It's all mechanical problem. If you have to really do this repeatedly at your workplace, have an abdominal brace and pivot with the feet, avoid twisting, because with the twisting movement, you are really squeezing that water balloon out of its place. Even in simple works during the whole day, you have to stay upright like that. Don't bend and say, I'm gonna do this. And the worst is the rotation. I've seen some people, they were just lifting their bag in the airport and rotating and twisting like that, and they do not come back because of the immediate severe spasm. And then we realized that they started to have a problem. They were predisposed to this problem by long-standing bad habits and bad posture. Again, the exercises, the gym. Choose the type of the sport and the exercise that matches your lifestyle. You are a busy man working long hours and your time is inconsistent. You cannot make a fixed scheme. So don't choose a high impact sport where you can all of a sudden lift a heavy weight and say this will make me strong. This will not happen. You can choose endurance exercises, calisthenics with the body weight exercises to build up the endurance fibers. That does not go if you have to stop for any reason, unless really you can make a fixed schedule and build up gradually your muscle strength over time. As we can see, this problem is rising. We were supposed to be like this with this gentle curve. Once this straightens up, it means that there is a muscle spasm. And most of the people stepping into my clinic now into this phase 2. And most of the people, they noted this hump, and some of them think, okay, I'm having a fat bulging here, the bone is protruding. No, it's actually you initiated that over the time by just not sitting properly, as simple as that. And sitting properly starts from the low back to keep the alignment of the spine straight, because our body can resist compression forces, but cannot resist tension forces. So think of it, I'm having a water balloon. If I'm gonna press it from the middle, nothing gonna happen. If I'm gonna press it from the edge because I'm tilting to the forward, it's gonna definitely with time slip to the back. So this is one of the most valuable images that shows what happened to most of the people over the time from the overuse of the mobile phone and digital platforms without really taking good care of their back. I see this. Most of the people, you step into their office for any reason and you found them sitting in this particular way. And as you can see, there is a massive compression force here. I am putting all the load as a compression force here. So I am forcing these small water balloons, which are the discs, the nucleus, to go backwards. So you can see it's a purely mechanical problem. The medicine will not help here unless I relieve that pressure. Painkillers won't work, muscle relaxants won't work. They will just add trouble to your kidneys and your stomach. They will give you temporary relief of the pain, but will not stop the process of the compression. And here is what's peculiar and unique about the back problems. It's different from joint problems. You can have a joint inflammation, a foot inflammation that can be treated with medicine or physiotherapy. But for this one, if you do not relieve that compression force and return it to be central on the discs, you will keep on pushing them even if you are pain free. So I want you to know this, that if you have had a back problem and you were diagnosed to have a back problem, a small disc bulge, a lumbago, a ligament injury in your back, being pain free does not necessarily mean that the problem is gone, unless you are really redistributing the load properly on the whole of your back. Because, okay, you have had a minor L4-5 disc bulge. After one more year, there is still compression on L3-4, L5S1, C5-6, C4-5, C6-7, and it keeps progressing. And that's why we see a lot in the elderly, what we call it multiple level degenerative disc disease. And those people, they walk 5-10 minutes and then they get cramps and numbness and weakness, and they cannot continue anymore without walking aid. When you ask them, Baba, when did this all start? You tell you, oh, 20 years back, and I was taking vitamin B6 and 12. Yeah, vitamin B6 and 12, what will it do for this mechanical problem? We can see here, it's a very common posture adapted every day by a lot of people, multitasking. Yeah, you can still do the same, but take care of yourself to maintain your health, to maintain your work and style. A problem on the rise. We see this a lot around in the parks, in the malls, in the restaurants, a kid just sitting like that 2-3 hours holding his video game, and no one is telling him you have to stay upright, and he stays upright few seconds and then lower bends again. And I've seen people nowadays in their 30s, and this is fixed like that. You ask him, please lie down on the back, on your back on the bed, and really there is a gap between this and this. I do the stretch test on the wall. I ask him to stand with his back straight to the back, and there is a big gap here. He cannot reach the back of the wall, and this means a continuous compression force, and this will force all of the disc spaces in between these bones to go and press on these nerves. So this picture shows clearly that it's a mechanical problem, compression force that will keep on pushing a disc after the other to go out of its place until it is beyond control or beyond repair. Sleeping, I'm gonna sleep 5-6 hours, some people 8 hours. Okay, so if you have a very low payload or a very high payload, and again this is bent all night like that, again it's a compression force in a different plane. It should be as much as you can straight like that even during your sleep. And the final thing, we see this a lot, all of the people sitting in transportation, in the parks, in restaurants, in cafes, in their office, and this mobile where all our lives is trapped in now with all of these applications, work platforms, and social interactions. Yeah, you can still use that. It became part of our new normal, but you can please use it in the right way to avoid the compression force that will inevitably end up with a disc problem, or worse, a multiple level disc problem. So it all starts by that I can do whatever I have to do, but doing it in the proper way. Here is a trick in the back, the protection by doing things in the proper way. Even these things, if you think they are simple, we can see this here. This cook is standing like that for 10 hours, and all of his neck is out of plane from the rest of the back. And again, if we relate to the previous one, the compression force will force all of these ones to go outside. Here, he can simply do the same by elevating this or having a higher platform to work on. Mothers with their babies, she's putting the baby on the bed and leaning forward 15 minutes to change his diapers and put on his shoes or tie his shoes. She can do this on a high table or make him sit on a high chair. Doing sports all of a sudden, or carrying, shoveling, sweeping, you can do this again, but with a little force and slow movement. You cannot have a sedentary lifestyle, a busy week, and lack of proper sleep, lack of exercise, and then in the weekend, all of a sudden, go and do a heavy work in a wrong way. This is how you can hurt your back. So you can hurt your back either by having a very simple bad posture, but it is cumulative over time, or suddenly doing something wrong. People who drive long distances also have to take care of their back, and they have to have, if you are driving more than 3-4 hours, you have to have rest, because for driving, it's not only the position, it's also the transmission of the micro motion of the engine to the back. You have to have the elbow resting on the consoles. You have to have your back straight and your knees semi-bend and the elbows semi-bend, so that you don't get injuries to any of your body parts. Neither leaning backwards too much or having it stuck to the front too much. And think of your neck and shoulder and hip and knee posture while sleeping. And for me, the ideal sleeping position is like that, because there is no force whatsoever on the vertebrae. Unless you bend it like this, again, you get the compression force. There is no magic solution for the back, and that's why the protection is better. A lot of patients, I'm sure you met one day, or I hope no one hears about that, but they get a back surgery, and then after a couple of years, he needs another surgery. And then later down the course of the life, he needs the fusion, because simply no one told him or took with him the effort to rebalance the mechanics of his back, realign the posture, re-strengthen his back muscles. You remove an L4-5 bulging disc this year, the compression forces stays, then a couple of years later, it's another one, L5S1, L3-4, or worse, the neck. Injury prevention is very important topic. I've seen a lot of back injuries recently in basketball playing and in doing weightlifting exercises or trampoline jumping, because of lack of adaptation or stretching before doing the exercise. You have to have a regular exercise. If you are a busy man, overweight man, a diabetic, hypertensive, cardiac, choose the sport that's simple. Just start with walking, with running, with breathing exercises, with endurance exercises, with calisthenics, to re-strengthen your muscles, because our muscles not only move us, they counter the forces on the body. So if the forces are compression forces, the muscle is pulling up and keeping you straight, balancing these forces, ending with zero force on your structures. If the muscle is weak, the compression forces are predominating, and if they are not falling in the right spot, they create problems. So we have to always think mechanics when we are talking about our back. Conditioning will help you also in reducing your blood pressure, decreasing your fat store, increase your heart function, and making physical activity a part of your life 30 minutes a day is very important. This slide shows the extremes of things I'm also seeing every day. Step one, apply a miracle cream. There is no miracle cream, and it won't differ if you are applying Voltaren gel or Fasten gel or Reparil gel or Demo. It's personal preference. Who gets relief with one, gets some irritation or worsening of his symptoms with the other, and the opposite. And then step two, after applying the cream, run 10 miles. It is neither this, neither that. It's in what's in between by keeping just good posture and simple exercises. You don't have to rely only on medicine. It won't help and won't stop the problem, and overdoing will get you an overuse injury unless this is a routine part of your daily habits. Focus on the strengths of your core muscles, your trunk, your abdominal muscles, your gluteal muscles, and do simple stretches at home. You don't have to have it sophisticated or complicated, and join some classes if you are busy. You can just do these simple stretching exercises at home to maintain the flexibility so that your body can withstand the daily forces implemented on it by prolonged hours of work. And thank you very much.
Thank you so much, Dr. Labib. Very informative talk. In fact, while looking at the visuals, I could imagine myself, and I think most of us have the same posture, whether it's driving or sitting in the office. So let's go to the chat box and see if we have questions from the audience, and we'll take a few of them. Yeah. Okay. So there's a question from Miss Catherine. She is asking, can you talk some more at the end of the session about cracking your back and neck? Okay, which at the time can give relief when sitting for a long time. What are the long-term effects to the body? Thank you.
Okay. So yeah, in the back, there is a small joints called the facet joints.
Right.
They are tiny joints, very superficial joints, responsible for helping the discs in moving the body forward and backward. And they are just aligned like that. They can do only forward and backward movement, and the disc from the front can do the rotations. So usually a noise comes from a shear stress. I can do this all day and nothing happens to my fingers. But if I keep doing this for 1 hour, then I will start getting blisters and redness. Our body can resist compression, but cannot resist shear. And the noise comes from the shear stress. So what I am doing is that these joints that is supposed to only move forward and backward, I am cracking them like that. So I am continuously wearing them out. And that's how down the line people get something. We said in the beginning, it's called facet joint arthropathy. And that's why whenever you have a back problem, you have to be checked. It is not a disc problem, but there are other causes of the pain from your muscles, from your facet joints, from your nerves, from your tendons and ligaments. So keeping on cracking the facet joints, yeah, it gives temporary relief by relieving the secondary muscle spasm like there, but it creates degenerative arthritis of these facet joints. And this is the one for which we have to do some injections, some radiofrequency ablations, and in severe cases, decompression. So actually stretching and strengthening of the back is much beneficial than just cracking it.
Okay, great. So I hope that answers Ms. Catherine's question. There's one more question from Annie. Annie is asking, what are the symptoms of sciatica and what should I do if I think I have it? How does it occur? So she has got a question about sciatica.
Yeah. So sciatica is a presentation of a nerve problem in the leg. It can happen from different causes. It can happen from a pressure of a muscle in the gluteus region, but the most common cause is from a disc problem in the back. And it is characterized by being a deep pain, severe, agonizing, or sharp, or numbness, or tingling, or electric pain going from the back of the hip down all the way to the ankle or the big toe. We use this term to tell ourselves that this person is having a problem, not in the beginning, but it might be down the course of the process that was initiated long ago by having already a nerve pressure. But some of the cases, they are not really a nerve pressure, they are just referred to pain. And that's why whenever you have sciatica, you have to be examined by a specialist in the back problems to differentiate between it is just nerve irritation and the problem is in the beginning, so you need some anti-inflammatories, back muscle strengthening program, or it is really a nerve pressure and that nerve pressure have to be relieved by a way or another, whether this way is medicine in simple cases or intervention with an endoscopic or minimally invasive procedure in severe cases.
Great. I hope that answers Annie's question. Let's take one more question. Okay, Nairi is asking, can jaw and shoulder and hip pain all on one side be connected?
The jaw usually is not connected. The jaw is usually coming either from an inherited problem in the masseter muscle, trismus, or improper occlusion. And that's why it's checked by maxillofacial or head and neck surgeons. It's not related to the orthopedic. It's different nerve supply. And problems with the jaw are common and they are not related to a back problem unless that particular person, and then it will not be in one side, it will be asymmetric or bilateral, is having a connective tissue problem. People with rheumatoid, with systemic lupus, with ankylosing spondylitis, and these are minorities. It is not the major. But if you are having a back and a hip and a knee problem on one side, this is because neurologists explain that by that every one of us is having a dependent side. For me, it's my left side. And I notice when I stand, I'm more leaning on the left side. For others, it is the right. And that's why degenerative problem starts in one leg for some people. And then after a while, they come after 6 months or 8 months, they come and tell me, Ahmed, okay, it's now starting the other one a little bit, either seem like the first one or the first one was already getting better because he focused on treating this one. So yeah, the back and the hip and the knee can be connected if it is a nerve problem, or it is your dependent side or the overloaded side, but the jaw usually is not unless there is a neurologic or rheumatologic disorder.
Okay, great. Hope that answers your question, Nairi. One more question from Catherine. Can you share some simple tips on ergonomics and or working from home, as many of us are sitting for long hours at our desk? I think that's a very good question from Catherine. Your take on this, please.
Okay. Yeah. So there must be a mindset change that, yeah, you are working from home, but this is your office. You are working from home, it just saves you fuel and license and driving for 1 hour and this is stuff. But it is your office, it's your new office. So you should get a desk at your home or use your kitchen table or use your dining table. Use a regular chair with a straight back and put a lumbar support pillow, because all of the malalignments of the neck and the cervical disc and neck disc problems, they start from having a back posture from the low back. So you should put a lumbar support pillow to keep your back straight. Sit as if you are sitting in your office in a proper way. Every 1 hour, have few steps around and do some stretching. You are not at home to sit on the sofa or on the bed and close your camera and be bent all day long and then my back hurts. Then it will definitely hurt. So please do some stretching exercises every day, 20 minutes, and think of it, I'm not in my home. I got up, I took my shower, I got well dressed, and I'm sitting in my office, but it happened that I'm not driving anymore, and that's it.
Great. I hope that answers the question. One more question, and Paige is asking, I usually get leg pain when I wake up. What is the best position for the legs during the sleep?
Yeah, so we call this the baby position, when you are sleeping on the side with the hips and knees bent a little bit. And if you are having a little bit of sciatica or leg pain, you can reduce the tension on your upper leg by putting a soft pillow in between the two legs at the level of the knees. So this will reduce the tension. But if you are having a pain, even if it is just night pain, and it is persistent or recurrent with the same pattern, you have to be checked to get it early, fix it with proper guidance by a proper therapist after being checked by the specialist that nothing is wrong with you, so that the stretching and strengthening exercise, if you do them for a while, you will not have these night pains. But usually sleeping by the side is the best with the hip and knee bend a little bit.
Great. Let me see if you have any other questions.
Yeah, I can see two more quick questions.
Yep.
The shoulder cracking, yeah, this is usually a tendon problem, and it affects professional handball players, professional swimmers, people who do weightlifting, civil defense people, engineers in the harbors going up to these tiny ladders. If you are not one of those, you can do simple physiotherapy and stretching for this to prevent habitual dislocation or subluxation and avoid a real dislocation if it is really popping front and back. And for the other, the neck pain in the morning, this is the pillow. So you have to have a firm pillow, not necessarily one written on it, a medical pillow. We don't know how medical it is and how far did they go in their research. It is coming from different sources, different factors, different countries without a reliable study or feedback. But you have to have a firm one, supportive for your neck. Like when we have seen in the presentation, the idea is to keep a straight relation between your bones to avoid any abnormal pressure on the discs in between, to avoid waking up in the morning with this neck and trapezius muscle spasm and stiffness that progress down the line to go to the shoulder and then the arm, the natural history of progression of back problem if people do not take care of their back.
Great. So I think we have a very good audience around today for this program, and I hope all of them have enjoyed. And a take-home message. Lastly, I would like to have a take-home message from you for every one of us. Like all of us are office goers. So one take-home message just to keep our that back straight and avoid these complications.
In the back, Mr. Samir, the protection and the prophylaxis is much easier and much better than the treatment, because once the process starts, it will keep on progressing down the line. And it's really very simple. Keep a good posture, do simple stretching exercises, strengthen your back muscle. Think of your work location at home that it is an office, but you have been saved an hour in the morning, hour in the afternoon of driving. So don't do it on the sofa or on the bed, and don't do heavy weight lifting to strengthen your body. You will injure yourself if you are a busy working man and not a regular training guide. Go for body weight exercises, calisthenics, simple things that will keep you firm and fit and healthy.
Great. Thank you so much, Dr. Ahmed Labib. That was a great presentation, very informative, relating to our daily lives. I hope all the audience have enjoyed it. I have left our website in the chat box. If you have any queries regarding our orthopedics department, you can go and visit there. Go check profile of our orthopedic surgeon, especially Dr. Ahmed Labib as well. And finally, I have left my email ID as well. If you have any further queries or you would like to come over and meet our doctors, get the advice, you can always contact me. I think that's it. A great attendance as well. Thank you so much, Dr. Ahmed Labib.
Thank you, Mr. Samir.
Thanks a lot. It was a pleasure.
Take care.
Thank you so much.
Okay.
Thank you so much.
Bye-bye.
Thank you so much, Dr. Okay.